Keratoconus is a problem with the cornea. The cornea is the clear window on the front of the eye, and keratoconus is a degeneration of the cornea on the front part of the eye that people sometimes develop. It can start in teenage years or it can start later on. And basically, sometimes people know they have keratoconus. The eye doctor can see keratoconus when they look at their cornea, and other times it's a little more difficult of a diagnosis. So what it actually happens is the cornea starts to degenerate and thins out, and it starts to bulge. So it forms like a cone or a bump on the front part of the cornea. So normally the cornea, which is the clear window on the front of the eye, is nice and smooth. And with keratoconus, it forms like a bump on the front surface of the eye, which creates a lot of problems like glare, reduced vision. Even with glasses and soft contact lenses, the patient's vision is usually reduced, and it usually requires, a hard contact lens to help correct the problem. The main complaints are, there's a lot of glare, especially at night. They see starbursts around lights. It basically creates an irregular astigmatism. A lot of people have astigmatism, but it creates an irregularity or a distortion to the person's vision. And keratoconus can range, it can be very mild where people can still wear, glasses and their vision is just a little reduced, or it can, cause scarring to the front of the eye if it's really advanced keratoconus. Sometimes people require a corneal transplant, with really advanced cases of keratoconus. Up until actually just recently, like a month ago, the mainstay treatments were you wore hard contact lenses to improve your vision, and usually, as long as there's not a lot of scarring to the cornea, the vision is pretty good with hard contact lenses. So people, once they get used to the hard contacts, do very well with them. And that's still the way we treat it. But now there's something called collagen cross-linking. It's a new procedure that was actually recently FDA approved about a month ago. It's still not really covered by insurance companies. We're still getting there. But it's been around for a very long time in other countries, and the United States has finally finished the FDA trial of it. And what that actually does is it uses something called riboflavin and UV light. They treat the eye with the riboflavin drops and then UV light on the cornea, and what it does is it actually re-strengthens the cornea to stabilize the keratoconus. So it does not reverse keratoconus, but it actually re-strengthens those bonds on a molecular level in the cornea to stabilize the disease, to hopefully so that people don't progress as time goes on.